I know a lot of women have gotten pregnant and they say their belly fat has increased. How can I get this belly fat off? This is what we're going to be talking about. I'm going to share to some of the tips that I used thanks to my sister and thanks to my husband. And some of the women will be asking again, when can I start, doctor, doing exercises or trying to lose this belly fat after pregnancy? This is Talk Pregnancy, Dr. Noela, where we tell you all about pregnancy and other women related health issues. And of course, to our subscribers, thank you very much. Those who have not subscribed, what are you waiting for? Hit on that subscription button and then the notification bell. Thank you very much for doing that. Let's go. You should know that getting pregnant and after delivery, that's 6 weeks or 42 days after delivery, is still the period of pregnancy. You can still consider it a period of pregnancy, and that is what they call the preparing period, because that is a time where everything in your body, where all the changes that occur during pregnancy goes back to normal. And how does this happen? During this period, you know, many women, once they deliver, you see them tying their lower abdomen with a cloth or a waist belt, especially those who delivered vaginally, not through a cesarean section, because they don't longer feel pain, so they tie it. There is no study showing that it is really effective in bringing back the abdomen. There is no study showing that. And if you're comfortable doing that, I have no issues. You can go ahead for doing that if you're comfortable. Now, for those who had a cesarean section, you might not be doing it because you're feeling some pains there and it's very difficult to tie your belly, and you might feel a little bit bad. You might feel bad like others are doing it, and maybe, or you did it for the first pregnancy and you had your flat tummy, and now you're having a cesarean section. Because many people will say if you have a cesarean section, then your abdomen is not going to go back to the way it was. No, 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 no. Let me tell you the secret. Remember, I've made a video here of sharing my story on my pregnancy journeys. My first delivery was a cesarean section, and I went back to my pre-pregnancy weight, my pre-pregnancy size, even the abdomen, before I was even taken in for the second pregnancy. It is very, very possible to have your normal tummy back after a cesarean section. So please, let's not confuse this. There are even people who had a vaginal delivery who still have a big belly fat. So what did we do? What did I do? What are the tips I used? Okay, the first thing is, when should you start? Let's start from there. When should you start? It's important. First, you have to start at least after 6 to 8 weeks. That's about 2 months. 6 to 8 weeks after delivery. 42 days is 6 weeks, and at least 2 months gives us 8 weeks. So it's important, it's good you start after that. And even after that, you might still be feeling some discomfort, not feeling maybe ready to carry out any exercise. So that's fine. Once you discover that you are ready to carry out an exercise, then you can do this. The first thing is, you might try doing light exercises, especially floor exercises, which helps tone the abdominal muscles, and maybe core exercises. So where you're doing stretch out, some of the activities, the exercises I do, you lie on the floor and you tone the abdominal muscles, and you struggle, you try to move your legs. You move your legs. Once you're doing that, you're working on the abdominal muscles. You can also lift up your buttocks up with your waist off from the floor while you're lying, and you stay for some time. You can do that frequently as well. Then sometimes you can use like some weights and also work on the abdomen. So these are just some of my videos that I've been doing, and it helped me thanks to the coaching of my husband, who is also an exercise coach. This is what he has been doing, and this is how he has been working up with us as we do the exercises together. If you start doing this exercise and you feel any pain, you stop immediately, please. And know that after this time, you should not be feeling any pain or any problem. You might feel maybe a discomfort, then that's fine. But if you feel the pain or really something, a change, report immediately, please. And sometimes, before, if you had a complication, your own dates, your own time to start might take longer, and you might need to ask your healthcare provider before you start doing any exercise. It's very important if you had a complication before. Now, once you have done these exercises as well, and you see that okay, it's going on well and you're feeling a little bit fine, then that's good. You can continue with those light ones. Then core exercises like swimming, riding, and many others, you can do those ones as well. This will help you, and it will be exercises that concentrate on the abdomen, where you increase the tonicity of the abdomen. Now the last one is, it's important to associate with diet. But if you are breastfeeding, because you are advised to breastfeed your baby for at least 1 year and even more. If you are breastfeeding, then I usually advise not really getting into meals or the fasting techniques which many people talk about. I don't usually encourage that if you are breastfeeding, because sometimes you might not know what level which it might not affect the baby. So most of the times I always say eat moderately as to feed your baby properly. Those are the statements I make. But once you have stopped breastfeeding, you have the right to follow other plans. You can follow any plan that you want to follow, especially with feeding and the intermittent fasting which you prefer, and the ones which you think you can go with it. After that, you can follow that planning. So it's very important that you consider yourself after pregnancy. Give yourself time. Remember that pregnancy is not an easy thing. Changes come, and you cannot control those changes at all. You can only control maybe like the weight gain with what you eat as well, because definitely you should not just eat anything. Even if you're not pregnant, you should not eat anyhow. Of course, you should moderate your meals and eat healthy food. So it's important that if you have a diet coach, or you have an exercise coach, you can follow their plan of action. But it's important that you know when to start and the type of exercises you should start gradually, then you start increasing it. Then with meals plan, it's advisable to start, eat moderately, eat very well. If you want to do now real weight loss, you can do it after you have stopped breastfeeding. Please, I hope this was helpful. This has helped you to gain more insights on how to lose belly fat and when to start, especially after pregnancy. So if this was helpful, give it a thumbs up to our video, and don't forget to subscribe to this channel, because we are coming here with a lot of information concerning pregnancy and other women related health issues. Please hit on that notification bell so that you'll be notified for any video. And if you want to have a private consultation with me, don't forget to click on the link below and you have one-on-one consultation with me. Thank you very much, and God bless you.